The business Okay, guys, this afternoon's A is talking about taking care of older Americans, elderly Americans, the business of taking care of older Americans. That's the title. So we will get into presentation A for you this afternoon. Here we go. But before I do, this is a question and answer session also. So as I'm going through the presentation for y'all, you may come up with questions on this topic for me, and we will have a live chat about today's discussion A for y'all. So here we go. The phrase, the business of caring for older Americans, is a deepening crisis, captures the page's central argument. Elder care in the United States is not simply under stress. It's unraveling under the weight of converting financial, workforce, and policy failures. Core message of the page. The surrounding content emphasizes that elder care, whether in nursing homes, assisted living facilities, or home care agencies, is increasingly unsustainable. Providers are squeezed between raising costs and stagnant reimbursement, while the workforce that sustains the system is shrinking. Immigration restrictions further reduce the pool of caregivers, creating a perfect storm that threatens both access and quality of care for millions of aging Americans. Why the crisis is deepening. Financial pressures. Medicaid and Medicare reimbursements often fail to cover the true cost of care. Facilities operate on a razor-thin margins, leaving little room for wage increases, infrastructure upgrades, or innovations. Workforce instability. Caregiving jobs are physically demanding, emotionally taxing, and chronically underpaid. Turnover rates are high, and many workers leave for better paying jobs in other industries. the this uh, crumb this crumb this term underestimates continuity of care and drives up recruitment costs, immigration limits. Historically, immigrant workers have filled critical gaps in elder care. Stricter immigration policies reduce this. Labor supply, worsening shortages and forcing some providers to scale back services or close entirely. Demographic pressures. The aging population is growing rapidly, meaning demand for care is rising, just as the system's capacity is shrinking. Together, these factors from a reinforcing cycle. Financial strain leads to understaffing. Understaffing leads to lower quality and lower quality and lower quantity. Quality errors, trust and stability. Consequences for older Americans. Barriers or access barriers. Seniors face longer wait lists, fewer available beds, and reduced home care visits in rural areas. Entire facilities may shut down, leaving families with no local options. Quality decline. Understaffed shifts mean rushed care, missed medications, and increased risk of falls or neglect. Deferred maintenance and training further compromises safety. Family burden. As providers raise prices to cover cost, families shoulder higher out-of-pocket expenses. Many are forced into difficult trade-offs, such as providing unpaid care themselves or settling for less suitable arrangements. Equity concerns. Marginalized communities already facing health discrepancies are disproportionately affected when access shrinks and cost rises. Suggested solutions. The page highlights several potential remedies, though it notes they are politically and fiscally challenging. Public investment, raising Medicaid, Medicare reimbursement rates to reflect real costs, for workforce support, increasing wages, offering career pathways, and investing in training to make caregiving a sustainable profession. Immigration reform, expanding visas or pathways for foreign caregivers to stabilize the labor force. Innovation and redesign, exploring new models of community-based care. Technology integration and preventative health strategies to reduce reliance on institutional care. Broader implications. The crisis is not just about elder care, it reflects deeper systematic issues in American healthcare and social policy. As the population ages, the gap between demand and capacity will widen unless structural reforms are made. Without innovation, the US risks a future where older adults cannot reliably access safe, dignified care. And families are left to absorb the cost and responsibilities. Bottom line, folks, the surrounding page frames elder care as a collapsing business model at the intersection of economics, labor, and policy, unless wages, reimbursement, and immigration pathways are addressed. The crisis will intensify, leaving older Americans more vulnerable and families more burdened. It is a systematic challenge with urgent and long-term stakes. Guys, I have to do this show tonight because of elder care systems collapsing, because of policies. Things have to change in order for people to get the care they need. Facilities have to look at that. Governments have to look at that in each state, local governments. And where it falls apart, guys, is local. It starts to fall apart in the local communities where the facilities are. I think it has to be a two-way street. Meaning, I think that local aging agencies need to come in and look. Sure, it could be a private facility, but let's say, for example, your person's aunt goes in for care, and care starts to drop because wages plummet because they don't, facilities want the person to come in for care, but they lapse in one area, folks. They lapse in the area of personalization. When you go to facility now, um, it's not personal anymore. Meaning that you, as a person, after your Medicare or Medicaid runs out, you as a person pay out-of-pocket expense for everything. If your coverage runs out for care, you pay like where I live, the one facility where I live, you, after your care runs out, after your Medicaid or Medicare runs out for coverage, you end up paying $420 a day to stay in a facility. Let's say, for example, that Uncle Joe goes over to a independent living apartment side. Okay, you still pay $120 a day, folks. After your Medicaid, Medicare runs out, people have to dig into their savings. So my suggestion to folks is, when you start looking for care, when you have to start thinking about, setting up care for yourself or family member, set aside a care fund. Put aside so much a month for let's say, you have to go in the hospital, for example, and then you come out needing to go to a rehab center or facility for a while, but your Medicare runs out. Then you end up paying out of pocket. So what I'm suggesting, that people set aside a care fund for themselves. Put so much aside for care. Allocate so much a month for a care. So when you do need it, it's there. The extra cushion is there for you to use for care. Because when it runs out, you end up paying out of pocket. I remember a time when facilities cared about the person who came in to get services. But now facilities care about the person still, but when your money runs out, they make you pay so much a day for that, like I said. So, set aside, start setting aside funds early for you to have elder care. That makes sense for people. That makes sense for folks. I want tonight's question and answer session is gonna entail what you guys think. How does everybody see that? So that's why I'm doing tonight's show. So give me a few minutes, and we'll get the question and answer session going. Give me a couple seconds to move my notes, and then we'll get the answer session going. That's for A tonight. So tonight's show kicks off the evening for me. So we'll see what y'all think when I put the question out there for you. Here. Calendar. Yeah. Yeah. Okay, guys, I just put the question out for you. Now I want to see everybody's answer for this one. What does everybody see, how does everybody see care in the future? Now I know everybody has different feelings on this, so I want to see how everybody answers this question for me. Let's go, folks. I want to see some answers about this question. I want to see if I can do another show on it with people's input. Okay, so I'm going to leave that one for y'all. Leave your answers in the comments below for me, please.